Scientists and doctors from Singapore have developed an airborne surveillance system that detects the presence of COVID-19. And this is what the device looks like. The team from the Singapore Centre for Environmental Life Sciences Engineering at Nanyang Technological University and the NUS Yong Lin School of Medicine trialled it into inpatient wards of a local hospital caring for active COVID-19 patients. They found that the air surveillance approach produced a higher detection rate of the virus compared with surface swab samples collected in the same area. Singapore currently uses wastewater testing as a means of detecting viral fragments. To tell us more, I'm joined by Associate Professor David Allen from the Infectious Diseases Translational Research Program at NUS's Yong Lin School of Medicine, as well as the study's co-lead author, Dr Irvan Luhung. He's a Senior Research Fellow at the Singapore Centre for Environmental Life Sciences Engineering. Welcome, gentlemen. What are the main reasons for embarking on this air surveillance approach? Prof. Allen, let's start with you.
Thanks, John. It's a proof of concept exercise. We're interested in finding out if we could detect virus through this method, particularly in areas in the hospital where there's high flow, high ventilation. So in negative pressure rooms and in open cohort wards, which is where we have many people with COVID, but it's open to the ventilation from outdoors. So it was important for us to see if we could detect it by this method and where we could detect it.
Right. Dr. Luhung, anything that you might want to add as well?
Yes, exactly as Prof. Allen said. I think an additional idea that I can add is that if you imagine if you perform a nasopharyngeal swab on a single person with this air sampling, and if you try to do air surveillance in a space where a lot of people agglomerate, you can imagine that one air sample can possibly represent this big number of people, so you can save a bit of resources on that side.
Right. And Dr. Luhung, now that you have some data from the samples, how and where can this device be used?
In principle, I think it can be used anywhere. But of course, you must think about all the important parameters when you do this type of surveillance. If you compare, for example, hawker centers, which is semi-outdoor, right, to a mechanically ventilated office space, you can imagine that the airflow pattern, the temperatures, and all the environment is very different. So in that case, we may need to do a lot of fine-tuning to maximize the potential of this airborne surveillance.
Prof. Allen, on a larger scale, how would this contribute to the larger COVID-19 fight? You know, especially when Singapore has transitioned to endemicity eventually. I mean, after all, living with the disease means SARS-CoV-2 is all around us.
Well, we're not just looking at SARS-CoV-2 as the only target. We're looking at respiratory viruses. We wanted to see that this would work. We wanted to see if we could isolate the virus and to grow the virus, because that would be meaningful to infection control and also transmission issues. But the places where it would be useful, even in the setting of endemicity, would be in places where there are vulnerable people. So in hospitals where there's cancer patients or transplant patients, or places where we might introduce more virus into the community or bring people into the community that may be not vaccinated or incompletely vaccinated or vaccinated not so well, that would potentially add a burden to our healthcare system. So I think the potential uses, as Irvan said, are quite extensive. It's just a matter of our imagination, and as circumstances evolve, where we see, aha, this would be a helpful additional tool to have.
And Dr. Luhung, you know,
Yes.
now that device is here, you've got the samples, it has gone through trials. What are the next steps? Any plans for it to be on the market?
Of course, that would be the ultimate goal, for that to be deployed in actual public spaces. But in the grand scheme of things, Being able to detect and make it work in such a highly ventilated space as a hospital actually showcased the robustness of this method, but that is not the only thing. If you think about actual applicability, you must think about what makes sense, how you integrate it with the existing surveillance systems that we already had. If I can give you an example, okay, I want to do an airborne surveillance of shopping mall A. Air is a very volatile media, right? You can imagine the concentration and the content in the air keeps changing all the time. Then what is a reasonable sampling time? Being able to detect it is one thing, right? But do you want to collect samples every 5 minutes? Then you will end up with hundreds, maybe even thousands of samples per day. Is that reasonable? Or maybe it's more reasonable to collect it in a few hours per sample or something like that. All this requires a lot of fine-tuning and also preliminary trial experiments. And I think that would be the next steps that can be improved.
Prof. Allen, Dr. Luhung, thank you so much for setting aside time to come on to the show. I've been speaking with Associate Professor David Allen from NUS's Yong Lin School of Medicine and Dr. Irvan Luhung from the Singapore Centre for Environmental Life Sciences Engineering.